Hey guys, this is FixerMed. Welcome back to my high-yield hematology and oncology review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering the entire system of hematology and oncology in a comprehensive but high-yield manner. This will be part 6 of my multi-part video series of doing so. Today, we will be taking a look at secondary polycythemia. Without any further delay, let's go ahead and get started on today's content. Let's start off by taking a look at an overview of secondary polycythemia. There is an isolated increase in red blood cells due to elevated erythropoietin levels. White blood cells and platelets remain normal. It is commonly observed in lung disease patients with decreased arterial oxygen tension. Kidneys detect low oxygen levels, prompting secretion of erythropoietin, which stimulates bone marrow erythroid precursors. Renal cell carcinoma may also produce erythropoietin, along with parathyroid hormone-related peptide, causing hypercalcemia. Exogenous administration, such as in cyclists, can also induce secondary polycythemia. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 55-year-old male presents with a history of chronic obstructive pulmonary disease, COPD. He reports fatigue, headaches, and dizziness. Physical examination reveals facial plethora and engorged retinal veins. Laboratory tests show elevated hematocrit and hemoglobin levels. Which of the following is the most likely explanation for these findings? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. Secondary polycythemia commonly occurs in patients with lung diseases like chronic obstructive pulmonary disease, where decreased arterial oxygen tension stimulates the kidneys to secrete erythropoietin, leading to an isolated increase in red blood cells while white blood cell and platelet counts remain normal. This patient's clinical presentation of chronic lung disease, elevated hematocrit, and hemoglobin levels is consistent with secondary polycythemia. Therefore, the correct answer is C, secondary polycythemia. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Chronic myeloid leukemia, also known as CML. CML typically presents with leukocytosis and thrombocytosis in addition to erythrocytosis. This patient's normal white blood cell and platelet counts argue against CML. B. Primary polycythemia, polycythemia vera. Polycythemia vera is characterized by panmyelosis, including erythrocytosis, leukocytosis, and thrombocytosis. The absence of leukocytosis and thrombocytosis in this patient makes polycythemia vera less likely. D. Iron deficiency, anemia. Iron deficiency anemia would present with decreased hematocrit and hemoglobin levels, opposite to the findings in this patient. E. Thalassemia. Thalassemia may present with microcytic anemia, but it does not typically lead to elevated hematocrit and hemoglobin levels as seen in this patient with secondary polycythemia. All right, guys, that is all I have for this video today. If you like this type of content, be sure to leave a like and subscribe for more content like this in the future. Be sure to leave any questions, comments, or concerns down in the comment section below. This is FixerMed signing off. Be sure to have a great day, everyone, and good luck studying as always. Goodbye.